name is Bianca Birdsey and I'm a mother of 3 beautiful girls. I'm also a medical doctor and have recently moved from a very deep rural setting where I was in charge of the pediatric department for 4 years in a district hospital. The reason for our moving was that we recently discovered that all 3 of our daughters have significant hearing loss. Significant enough to essentially render them all deaf. Let me tell you a little bit of my story. My oldest 2 children are twins, and their antenatal history was essentially normal. Their birth was uneventful, and they were normal babies, healthy babies. And because they weren't classified as high-risk babies, we were not offered newborn hearing screening. Their developmental milestones were largely on par, but we noticed that they did have some speech delay. At about 18 months, I noticed that their speech really did plateau, and it was really at about 2 years old that I started becoming quite concerned. Concerned enough to approach professionals for some advice and just to see what they thought might be going on. The professionals that I approached were a variety of, a spectrum of professionals really. There were pediatricians, audiologists, speech therapists, and occupational therapists. And because we lived so far away from the city, I made telephonic appointments to have formal discussions about my concerns. They all reached a resounding conclusion, that being that I was probably just being a bit paranoid, and this was probably just a twin thing, and that I should really just see how things go and reassess their speech in a few months' time. I was dissatisfied with that, and as a result, just started doing a million little home experiments to try and test their hearing, and also engaged with a lot of different speech therapy exercises in the afternoons with my children to try and see if we could improve their speech. The exercises were largely futile, and the experiments just left my husband and I further confused and further frustrated. So in June last year, when my girls were 3, I decided to take one of them down to the nearest town to have an audiologist screen her hearing. This was done with behavioral audiometry in a soundproof booth, and the results showed that she did probably have hearing loss. She then referred us for further objective tests, being an ABR and ASSR in the city, where we took both of our girls. The results of those tests confirmed our greatest fear, that they both had significant hearing loss, profound on one side and moderate to severe on the other. We were devastated and had to make plans to make an urgent move to the city to get them help and be able to access resources. 2 months later, we had our 3rd child, who was 20 months at the time, was hearing tested, and to our horror, it also showed that she had significant hearing loss, very similar to that of her sisters. It really did feel like our world had completely imploded and started our journey as parents of deaf children. For the first 6 weeks of our journey and several audiologists later, we still had not been referred to any form of support group or holistic early intervention program. And as parents with this new diagnosis concerning all 3 of her children, the grief was overwhelming, and so really we were incapacitated to try and make those steps ourselves to investigate early intervention programs. And it required the kindness of a friend to do some homework and investigation, and she gave me the contact details for High Hope's early intervention program, which is a family-based program here in South Africa. That was probably the kindest thing anyone had done for us up until then, and it really did prove to be an incredible lifeline. We opted to start off with hearing aids, and at that point in time found ourselves in a whirlwind of opinions with regards to school choices and communication means and options, and that's when it really helped to have a program like High Hope supporting us, who laid out the cards of all our different options in a very unbiased way, and really just empower us to make those decisions for ourselves at that point in time. Okay. 6 months have passed, and we have come from a place of extreme grief to very real hope. My husband and I are both really excited about our girls' futures and the individual unique plans that there are for each one of their lives. and it is amazing to no longer be oppressed by this perceived label of having disabled children, but rather to see them as being extremely able, happy and healthy, and having really bright futures ahead of them. 6 months of intervention has proved to be an incredible blessing to our family too. It's so amazing to see our children starting to communicate with each other and with us. It's really grown our inter-family relationships. Frustration levels have greatly subsided as they are able to communicate what they want or why they may be crying or frustrated, and it really has been just so incredible to see how they have become so much happier and more confident since they have been given access to language and learned to communicate. Have your baby's hearing tested as soon as possible after birth. Now this would initially be just a hearing screen, which if failed, the child will then be referred to further screening or further diagnostic tests. But really important to have that done, because if you don't know that your child has hearing loss, you won't know that you need to intervene on the hearing loss. If your child is ultimately then diagnosed with hearing loss, it's really important to seek out intervention as soon as possible, and holistic intervention, so that you can get that kind of support through this very real time of grief that you would need. Just a note on the hearing screening is that it's really not something to be too worried about. It is cheap, it is painless, it is quick, and it's objective. And so something really to not avoid and to take up any opportunity to do that. Deaf and hard of hearing children have no reason not to reach their full potential. They should be given the same opportunities as any hearing child. But this is largely dependent on them being screened and picked up early and then being integrated into a holistic, family-based early intervention program as soon as possible. My message to professionals is, firstly, let's all become advocates of newborn hearing screening. In South Africa, statistics show that there are about 17 babies born every day who are deaf. 17. If all of our babies are not being, or the majority are not being screened, most of those children are going to go undiagnosed, which would leave it up to parental concern at a later stage to pick up the signs and symptoms of hearing loss, which obviously include things like delayed speech and inattentive behavior and maybe learning problems. By this stage, we've lost some precious neuroplasticity time, as these things and concerns usually only come up between about 2 to 4 years old. So let's make the most of every opportunity by getting babies screened early, referring them appropriately, and then having them diagnosed as early as possible. Then with regards to early intervention, I just really want to emphasize that early intervention is not simply and not only the referral for an amplification device and onto speech therapy, but it is a lot more holistic, or should be a lot more holistic than that, addressing the psychosocial aspects of a diagnosis of hearing loss for a family. And families really appreciate having that kind of emotional support through this very intensive time of grief. And so supporting and referring patients on as soon as possible to a holistic family-based intervention program like Our Hopes is something that I think is really important and has been greatly helpful for our family. And then just to also realize that really this is a significant time of grief for a family, and to bear that in mind when giving families lots of information with lots of medical jargon too early on in the process and expecting them to make very big decisions, for example with regards to cochlear implants, far too early.